Hello and welcome to Chairside Live. I'm Megan Strong.
And I'm Will Schmidt, Registered Dental Assistant here at Gladwell Dental.
And today, you know what we're doing?
I have no idea.
I'm going to let you know. We're continuing Dr. Chi's series where he's addressing the common errors and solutions when taking digital intraoral scans. And in this second installment, he's talking about one of the most important factors in getting an accurate scan. And we all know what it is.
Not at all.
Moisture control.
Oh my goodness, it's as if we work in the least ideal conditions. So I think Dr. Chi today will talk about cord retraction, tissue management, of course, blood and saliva management. And more importantly, he's going to do this on a live patient while scanning the quadrant.
Woohoo! Let's go, Dr. Chi.
Taking impressions on patients is very, very challenging. And it's equally as challenging with digital impressions because now you're taking images of the teeth, the opposing, and there's a lot of soft tissue that move around. And one of those critical aspects is how do you create isolation, keeping the soft tissue out of the way, and moisture. Controlling moisture is extremely important when it comes to getting an accurate impression with digital scans. So we'll review some tips on how to control the moisture, keeping the soft tissue out of the way so that you can achieve the most accurate scan. Let's take a look. In this segment, we're going to discuss how to control moisture on our patient during the scan. In the lower posterior region, it's one of the most challenging areas to scan because there's an accumulation of saliva in that area, and also there's movable soft tissue that can really impact the accuracy and the efficiency at which we can scan with our digital impression system. So what we're going to do here is place some retraction aids, some isolation aids to control the moisture and allow us to accurately capture the prep area. So the first thing that we want to do before we take the scan is to use a saliva ejector or suction to remove as much of the moisture as we can, as much saliva and fluids as we can, and then while the area is a little more dry, then we can place some isolation aids like cotton rolls or dry angles to not only retract but to capture and absorb any fluids that might accumulate during the scan process. While those pieces are in, we also want to air dry over the preparation, the soft tissue, and the adjacent teeth. We want to remove any saliva or fluids that might be sitting on the surface of the teeth that could impact the accuracy of our digital impression. So let's take a look at how we're going to go through with these techniques to improve the accuracy and efficiency of our scan sequence. All right, so our patient has had the cord placed for about 5 minutes, and now we're going to prepare the lower right quadrant for our scan. The first thing that we're going to do is saliva eject or suction as much fluids and saliva as we can. I'll also use an air syringe to kind of blow off any excess fluids over the adjacent teeth first. I don't worry about the prep right now. I actually want the prep to remain hydrated, the cord to stay hydrated, so there's less of a risk of any bleeding during the removal. So we'll dry off the adjacent teeth, we'll suction any excess fluids, and then we're going to place any of our isolation aids like cotton rolls or dry angles within the lingual vestibule and the buccal vestibule to help absorb any fluids during the scan. So again, the first thing we'll do, usually during the time the cord has been sitting there for that retraction, a lot of saliva accumulation can occur, so we try to saliva eject or suction as much as we can. And then I'll use the air syringe just over the adjacent teeth to push off any excess fluids in those areas. Once that's done, then we'll place a cotton roll within the lingual vestibule. So depending on the space, usually one, but sometimes you can get 2 in there. And this, again, will help with the absorption of any fluids, and also it helps to retract the tongue, kind of keeping that out of the way, because we do want to keep an eye on the soft tissues surrounding the area we're scanning, because that could interfere with the accuracy of our scan. Once I place the cotton rolls on this lower quadrant, I won't really worry about anything on the buccal side, on the cheek side. So I'm just using a mirror to help retract this area. And now I want to pull the cord while it's still wet. So I pull the cord very, very slowly and while it's wet. Those are 2 key aspects of the cord removal at this point to help minimize any bleeding during the removal or post-removal. Once I remove the cord, now I'll evaluate the preparation. I want to ensure that I have the retraction that I was aiming for with the cord placement. And I also want to remove any excess fluid and moisture over the preparation. So I start off on the top of the prep and then work my way around the axial surfaces and now air dry within the sulcus. We want to get rid of as much fluids as we can. At this point, and of course if the patient has a lot of inflammation, any bleeding, you want to get that under control first. So if you notice any bleeding, go ahead and use any of your hemostatic agents like viscostat or astringent. Apply that to the soft tissue in the areas that are affected. Get that under control first. If there's any bleeding whatsoever and that is onto the preparation during the scan accuracy has been affected. So it's been decreased. So we do want to make sure that's under control. In this case, there's no bleeding. So now again, I'll make sure the prep and also the adjacent teeth again are really dry, because the more dry the area is, the better chance the scanner has of capturing that information. So now we'll go ahead and take our scan. And if you have any excess lighting, like your overhead light, you do want to turn that off or move it away. If there's a lot of excess light, it could also affect the way the scanner captures the area. So now I'll activate the camera over the preparation. And in this case, with the iTero element, the first scan that we capture will be of the preparation. So I'm focused on the prep. And again, the more dry the area is, the easier the scanner will capture the site. Okay, so in this case, we've captured the preparation. Now we'll move on to our quadrant scan. So for the quadrant scan, before the scan, really before any scan, I just evaluate the area. We can put a little bit of air over the preparation and adjacent teeth again, because it can be difficult as you're focused. There's so many things to focus on. Your positioning with the camera, the screen, the monitor on the scanner to watch the way our digital model is developing. So we can sometimes lose track of what's happening over the prep, whether there's fluids or bleeding that's occurring. So now for the quadrant scan, I'll position over the last tooth, and then I'll work my way toward the mesial and maintaining a position over the occlusal. So for all quadrant situations, for a single unit prep or multiple unit prep, if we're just concerned with that lower right area, I like to scan from the last tooth to at least the cuspid or the canine. Once I reach the canine, tooth number 27, now I'll rotate to the lingual, and now we'll capture the lingual surfaces of the adjacent teeth first in this case, and then begin working my way back to the last tooth. Now I'll rotate to the buccal. And on the buccal, once I rotate to this area and can visualize the buccal surfaces of those teeth, then I'll begin working my way toward the mesial. As we go toward the mesial, the camera may have less of a chance of retracting the lower lip. So you may need to use either your finger or a mirror or some type of retraction aid to keep that out of the way as we come closer to the front. And what can also help is ask the patient to close slightly, close just a little bit, and that way the soft tissue is a little more movable, so you can maintain that rotation to the buccal and capture the areas that are critical to the success of your preparation and restorative situation. But you can see the main things here. We started off with the suctioning of the excess saliva, and then we dried off the adjacent teeth a little bit. And after that, we placed a couple cotton rolls on the lingual vestibule. That helps with the retraction of the tongue and also the absorption of any fluids during the scan, because if you don't put those absorption aids, the cotton rolls, or even a dry angle, there could be saliva that will then seep onto the adjacent teeth and prep during the scan, and that could throw off the accuracy of your digital impression. That's how we go through the controlling of the moisture in a lower posterior situation. Again, suction, dry, making sure the area is dry, and then go through your sequence, making sure nothing else goes onto the prep during the scan, and then that way you can achieve an accurate digital impression.
Thank you so much for that, Dr. Chi. And stay tuned for the next installment in this series, where Dr. Chi will talk about acquiring proximal contact information.
Sounds like a good plan, but hey, if you missed the first episode, you can always head over to chairsidelive.com to catch up and get ready, because we got more coming.
Absolutely.
But for today, we're all wrapped up, so thank you so much for watching.
We'll meet you right back here next time.